Hi, it's Dr. Emily Poccia, naturopathic doctor and owner of Wildcraft Medicine. I am back to talk to you guys more about thyroid health and how it relates to fertility. In this video, we're going to talk about some of the different thyroid lab markers, why it's important to run them, and making sure that you're asking your doctors for the appropriate testing. So let's talk about thyroid hormones. So typically when you go to the doctor, a very common screening test that you'll see is TSH. This stands for thyroid stimulating hormone. This is actually a hormone that's released from the brain, the pituitary in the brain. It signals the thyroid and tells it to produce more thyroid hormone. This pattern, this signaling, happens when the brain registers that there's not enough thyroid hormone circulating in the blood. It says, okay, there's not enough thyroid hormone, let's stimulate the thyroid to make more thyroid hormone. That is typically the only hormone that's tested when thyroid is being screened, if doctors don't think there's any family history or major issues with thyroid. This is really important to make sure that you're looking at because it tells us a lot about the balance, but it's not the only marker. So then we have T4 and T3. These are the actual thyroid hormones that your thyroid produces. The thyroid hormone actually produces much more T4 than it does T3. So what happens is it makes T4, and in the periphery, in the rest of the body, you have a conversion of T4 to T3. T3 is actually the most active form of thyroid, and the reason why this happens is that it's a control or protective mechanism to make sure that you're not overproducing this very stimulating T3 hormone. So again, we've got T4, T3 released from the thyroid. T4 is then converted into T3, circulates around, the brain registers if there's enough, and if there is not enough, it stimulates TSH from the pituitary to signal the thyroid to release more. And if there is enough, then TSH isn't being released quite as much, it slows down, and there's enough thyroid hormone. So as you can see when I'm speaking, there's an inverse relationship between TSH and thyroid hormones. So what that means is if TSH is low, very oftentimes you'll see that's because thyroid hormone is high or elevated. That picture is a hyperthyroid issue, overproduction of metabolism. Or you can have TSH that skyrockets up, and you'll see that that's happening because there's not enough T3 and T4. T4 and T3 are low in the blood, and that's more of a picture of hypofunctioning. So metabolism has slowed down, and the brain is trying to stimulate the thyroid to catch up. So those are some basic patterns. I wish it was that simple, but it's not always. But those are some really common markers to make sure you're looking at: TSH, T4, and T3. Now, the other markers are free T3 and free T4. So what's the difference? So total T3 and total T4 is all the T3, T4 hormones that are both bound to proteins and not bound. And so what that means is thyroid hormones and hormones in general need to be bound to a protein to be transported through the body. This is a great way to move them into different areas that we need them, but your body can't utilize them until they come off that protein, kind of like a bus. They have to get off the bus, and then they can bind to receptors. So the total T3, T4 is all the T4 that's bound and unbound. The free T3, the free T4 is unbound. So they're not on the bus, your body can readily utilize them. Now it's important to also know that even though that number is very important, those free levels, it's a very small percentage of what's circulating in the blood. So I like to look at all of them: TSH, T3, T4, free T3, and free T4. Then we have something called reverse T3. So if T3 looks like this, reverse T3 looks like that. It's a very similar structure, but it's reversed and it's not active. Now our thyroid does naturally make some reverse T3, but we don't want that number to increase too high because then we have this inactive thyroid that's blocking the receptors and not allowing for our actual T3 to work. This number tends to go up when there's infection and inflammation in the body. So those are the first things to ask when you see a high reverse T3. Where's the infection? Where's the inflammation? Then there's something called T3 uptake. This is also has to do with the body's ability to transport T3 and release it. You'll see an inverse relationship as well with this number. If T3 uptake is high, you'll often see a low T3 circulating in the body and vice versa. Finally, the last two that I really like to look at are antibodies, looking at if there's any autoimmune issues with the thyroid hormone. Remember, we talked about Hashimoto's being associated with underproduction of thyroid and autoimmune, and Graves with an overproduction of thyroid hormone and autoimmune. So the markers for that are something called anti-TPO, anti-thyroglobulin, and then there's a few other ones that are specific to Graves. And it's important to take a look at those, at least those two first, the anti-TPO and anti-thyroglobulin. If you notice that there's a high, if your doctor notices that there is a hyperthyroid picture, then they may go back and run some other autoimmune markers specific to Graves. So it's a little bit about those different hormones, and the reason I bring them up, obviously you're not going to be interpreting these with your doctors, but if you understand that there's more than just TSH, and that's important to understand where the imbalance is, because that will help us figure out how to treat you appropriately. So you could have a normal TSH, but your T3 and T4 is out of balance. And I see this happen all the time. And so that would tell us that there is a conversion problem. Your body's not doing a very good job of converting T4 to the more active form T3. Or maybe your TSH is low and all your thyroid hormones are low. Well, that's not a typical pattern I know about. And what's happening there is the brain, the pituitary, is actually hypofunctioning. It's not doing a good job of signaling the thyroid, and so the thyroid is not actually producing thyroid hormone. So that's not really a thyroid issue as much as it is a pituitary issue. And then of course we have the actual thyroid issues where you can be overproduction of thyroid hormone or underproduction. So we've talked about hyper and hypothyroidism. We've got the autoimmune conditions, which again is not a thyroid issue, it's an immune issue related to the thyroid. So really important to make sure that you're looking at these markers, because it will tell you about where the problem is, where the symptoms are coming from. So it'll help you not just treat symptoms, but get to the root cause. And a lot of times we'll see these numbers off with infection, inflammation, other hormonal imbalances, food sensitivities or food allergies, as well as environmental issues and stress. So these are some really common root causes for having issues and imbalances in that actual thyroid hormone. So next time you go to your doctor and you're having some of these generalized symptoms of fatigue or weight issues, changes in appetite, you want to make sure that they're checking your thyroid, and I would suggest asking for at least TSH, T4, T3, free T4, free T3, T3 uptake, reverse T3, anti-TPO, and anti-thyroglobulin. That is 9 markers, and there are more. So next time you go to your doctor and you say you just see the TSH on there, make sure that you're asking for more. They may not always be able to run it. And if that's not the case, find a functional medicine doctor or a naturopath or someone else that will look at the whole picture so that you can get a better understanding of what's going on. Okay, so now that we have a great understanding about what the thyroid does and how those numbers can be off, let's talk about treatment in our next video. Stay tuned.